Hi everyone. So 30-week update. I'm 30 weeks as of yesterday. Had my 29-week appointment last week. I did not get to update you guys on that. Sorry, because I'm a lazy bum and I had a whole bunch of stuff to do. Okay, so 30 weeks. Had got my glucose screening test back last week. They said it was perfect. Excuse me. One of the doctors, Dr. Rosenbaum, she works with my physician, Dr. Groley. They work in the same office, both amazing. Said that she's actually never seen one come back as low as mine. She said it was perfect. Dr. Groley, my physician, said the same thing. He says it was pretty damn good. At that time, I had not had a chance to get my echocardiogram. It was another 2 days. It took apparently a month to get this echocardiogram taken care of. And Dr. Groley texted me last week and said that everything looked fine. So my heart looks perfect. My response to that was, so you're telling me I just got real fat real fast and that's why I can't tolerate it? And he, of course, like a good boy, said, absolutely not. That is not what I am saying. But he said, no, everything looks fine. Says I'm nice and healthy. So that's good to know. I was, that right there was kind of part of why I was like, people always ask me, will you do this again? That's probably the number one question I get outside of what's my compensation. Would you do this again? And me and my husband have taken a stance of let's just play it by ear right now. Let's just see how we get through this, see how I cope, see how I do afterwards. This will be obviously the first time I don't take a baby home with me. And while there is no emotional attachment, you just never really know what you're going to do or how you're going to feel, and how he's going to feel. So that's what we keep telling people. But the echocardiogram results is one of those things that I was really hoping to get back before I had to make any decisions on that, which we did. So I'm really glad, because if the echo had come back that maybe there was some pregnancy-induced like cardiomyopathy or, like just pregnancy issues that can mess with your heart, because it can happen, then that obviously would have changed the plan and not going to be able to do this again. But that's not the case. So it's on the table. It's not solidified. Is that something we would do or would not do? We're just going to play it by ear. But it said everything looks fine. So my heart looks really good. So now I just sound like a fat golden retriever whenever I run around for no reason. Probably because I'm just a fat. At least that's what I feel like. So yeah, looks good. He said, baby looks fine. It's right on schedule. It's growing fine. Everything looks good. Looks real good. There's not a whole lot to update this week. Anything that's updating pregnancy-wise is pretty simple. I go every 2 weeks now, starting this week or last week. So I go next week as well until the beginning of December, which I'll be 35 weeks at that time. And then we start weekly appointments. Oh my gosh, I can't believe it. Which is crazy to me because that means it's like almost over. I mean, I feel like it's been such a long ride and such a fast ending. Excuse me, I just ate my pizza. Yeah, I'm surprised. I feel like it went by so fast. So everything looks really good. His heart rate sounds good. I'm like 95% convinced this baby has settled into his head down position, because every once in a while I can feel a small squirrel scratching the top of my uterus, and I feel a lot of knocks, like bigger, more general knocks, like he's doing this or going like this. Down in my nether regions. I do not feel him, as I said before, dancing on my butthole, which is fine by me because I wasn't enjoying that. Excuse me. I did discuss with my physician this week some fears, which is probably the biggest part of my appointment was this week. I am not one that's big on medications. I don't like to put medications in my body. Which is so funny because I'm a surrogate and you have to basically do the opposite of that and stab yourself every night and do all these beautiful, wonderful things, and just to get your body ready to put an embryo in it. And I really trying to labor as naturally as possible. I unfortunately was induced with all my other children. Again, I was less educated at that time. I was not a nurse and I didn't pay as much attention to the evidence involved in things, and obviously didn't know as much as I do now because I work in it every day. And so it's very important to me that we try to avoid induction. mostly because induction increases risk of complications and increases risk of C-section, things like this. These are things I don't want to approach. And I discussed this with my physician, Dr. Growley, this week, because I'm slowly coming to realization that there's always a real possibility that I may have to go back to the OR and have a C-section, which is not something I'm about in any capacity whatsoever. Like, I can picture myself going into the OR. I can picture myself on the table. I can picture myself getting the spinal or whatever it is that they have to do to get me under and comfortable for this epidural, or excuse me, for the C-section. And it legit throws me into like a small panic attack. I can feel myself getting a little bit nervous talking about it and picturing it in my head. It makes me very nervous. And I discussed that with Dr. Roy. I did not have to have a C-section with my other children. They were all vaginal. But it's always a very real possibility. And I told him that. I said, how many times do we see these chicks come in who are on their 4th, 5th baby, and we're rolling them back to the operating room because something happened. Some baby's too big, or baby's malpositioned, or she's hemorrhaging, or there's no, like, baby's heart tones are down and things like this. So I'm very, very nervous about that, and I have explained to him that I do not want to be induced. I would really like to let my body go into labor on its own and let this happen naturally. I do labor unmedicated generally. I think with each of my kids I took maybe 1 shot of IV pain medication. Well, no, my first one I was doped up all day. The second one pretty much the same. The last one though, I think I took 1 little dose of it. And that was all I needed to get me through. And I know there's risks with that as well. But yeah, it was like this time. And again, I know different now. But I'm starting to grow very nervous about it. I'm starting to get very anxious about that part of it. And I'm starting to think forward about delivery time. Like I've said, we live 2.5 hours from the hospital. 2.5 hours from the hospital. And if I go into labor, we're just gonna have to book it. We're just gonna have to 2.5 hour drive to the hospital. And so I don't know, I'm a little nervous. And my baby's parents are gonna be here, and they're gonna be in Las Vegas, and I will be at home because this is around Christmas time. I'm due November 27th. It's 2 days after Christmas, and we spent last year in Las Vegas for Christmas. We really don't want to do that this year. And she's aware of that. So, but yeah, I'm starting to get a little bit more nervous about how this is all gonna logistically work out. Oh my goodness, I'm sorry about the yawning. My bad. So I don't know, but my physician, as far as my concerns, he said that, more than likely we're going to be just fine. Everything's going to work out. You have a proven pelvis, you have a proven body. You've done this before more than once. You'll be fine. Don't worry about it. You're going to be fine. Everything's going to be fine. And I trust that he will do everything he can to keep me out of the OR, and he's not going to take me back to the OR unless absolutely necessary for the safety of both me and the baby. But even still, it makes me very, very, very nervous. I told him that more than likely he would have to put me under, because I can't even picture myself calming, like not being able to stay calm enough to get through the spinal block. So I'm not 100% how that's going to play out. So we'll see. But yeah, that was really all we really talked about was that. And I'm just gonna keep going. I'm not sure how often I will update with the appointments being every 2 weeks, but maybe a little bit more frequently. I'm going to try at least. I do want to address a question I had so many months ago about pain management in labor. Now, my understanding and the way I have always been explaining this from day one, because it was very important to me that the parents understood that I do not take pain medication for the most part. I don't like medications in my body. I don't want them. I want to labor naturally and let my body do its thing. It was even more concerning to me, having worked with Asian families and seeing patterns and traits that I have seen in responses to pain. Most often what I've noticed is when my mother, who is of an Asian descent, and she has an Asian descent husband, more so from China mostly, is that the Chinese men do not at all tolerate their wives being in labor. They want their wives to be pain-free, and it concerns them that when they get in pain, and it not riles them up, but for lack of a better way to explain it, it riles them up. They get anxious and hey, we have pain, you need to come, we have pain, and we know they have pain, and we're doing everything we can to manage it, but they don't like to see any type of discomfort. That is just my experience that I have noticed in this type of family setting. It's most likely not true for all Chinese men and women, obviously. However, it's just something that I've noticed. And so it was really important to me that, knowing I was going to be working with a Chinese family, that they both understood that this was normal and that this was going to happen. And that I wasn't going to take pain medication just because they were uncomfortable with my pain. And I've been told from the get-go, no, it is 100% your choice as to how you labor, and what type of pain management you use in labor, while you're in labor. So I have not discussed that directly with my family since we met, and even then it was very short and it was kind of awkward via the translator. But I'm pleased to say that my mom seems to be open to more evidence-based stuff. Like, she's asked me to pump for the baby. She approached me about it. She said, would you pump for us while we're still in America waiting on citizenship? She said, because the breast milk is what is best for him, and we want what's best for him. So that was really exciting to hear, because I wasn't going to approach the subject with them. I just feel like a lot of moms in this setting would be more comfortable if, maybe they just felt like food was just coming from them. I don't know. So I'm going to pump for them, which is good, but I'm going to address soon here pain management when I'm in labor with them. I think I mentioned before, I did discuss with them who was going to be in the room during delivery, and we discussed that, so that makes me real happy. And it makes me much more comfortable in the laboring naturally in unmedicated settings. So, but yeah, my understanding is it's all me. I haven't been told anything different. I haven't seen anything different. I have seen where surrogates and parents have discussed it and come to a conclusion about what type of delivery and setting is best for them. But I have yet to hear of a surrogate being told she has to manage her pain this way, or she has to have an epidural, or she cannot have an epidural. It's generally, for the most part, the parents are usually very supportive of whatever the surrogate is comfortable with in that setting, because they just want to help the healthy baby. The biggest thing I have noticed is that parents want you to deliver in a hospital. I don't see it very often where parents want to or agree to a home birth or a clinic birth, like a birthing center. Those, because they want a NICU close at hand in case there's a little fuzzy. They want a NICU close at hand in case something goes wrong. So, yeah, I'm not sure. I don't know. My husband is like texting me crazy. Sorry. But yeah, that's my understanding, and that's my intent, is to labor as naturally as possible. I've discussed induction with my doctor, like I said, and I really don't want to be induced, and I want to let it go on its own. I think that's the best course and the safest course, because in the end, that's ultimately what we're about, is getting this baby out safely for family. It's very different, because it's not just you on the table. I've said it a million times. It's not just us that has a hand in this pot. We're factoring in them, but at the same time, I don't want to just induce for convenience. So if there's a medical reason, we'll discuss induction, and I told him that. But if not, then everything looks good, then let it go on its own. If I make it to 40 weeks, then we'll discuss induction at 40 weeks and see how far he'll let me go. So that's all I got. Excuse me. In non-pregnancy related news and legal news, we got our birth order stuff finally situated. We had a hard time of it. My lawyer contacted me about 22 weeks and said, hey, by all intents and purposes, you should be between 20 and 25 weeks pregnant right now. if that's the case, we really need to start working on a birth order. I am now 30 weeks and we are still not filed, but it should be filed next week. So that was a small feat in and of itself due to some lack of information received by my agency and whatnots. That is a whole nother post in and of itself. So, but it is going to be filed, and once it's filed, then everything is official that this child will not be mine when it comes out, which makes me really happy. So, that's that. Gonna have us a baby here in 10 weeks, you guys. 10 weeks, that's all we got. All right, leave your comments below, and I will see you guys next time.